Today, 3,164 new cases of COVID-19 are being reported across the state, and health leaders today held a news conference to talk about the spread of the Delta variant with hopes to slow down this rise in numbers.
Our Stephanie Poole joins us now live in the studio with more. Stephanie.
During the fourth wave of COVID-19, the Delta variant is bringing higher numbers of infection and leaving intensive care units with limited room to take in those with complications. But like most situations, it's going to get worse before it gets better. About 3 million people live in the state of Mississippi. 1,147 of those people are in the hospital with COVID-19. 299 are in ICU, and 150 are on ventilators.
We're just looking at some real significant pain points in the coming weeks. It's just inevitable.
As the Delta variant surges across the Magnolia State, state health leaders are addressing those concerns. At the top of their list, ICU bed availability and nursing shortages.
It's going to cause a lot of tragedy. Well, I think it's going to be a 10 in a couple of weeks.
Right now, we have 4 children in the ICU.
We only have 8 beds available in the state, and that's spread across 4 hospitals throughout the state.
Medical centers are even using space in emergency rooms to treat ICU patients.
We receive reports from many of the hospitals and their leadership about insufficient staff to be able to staff all of the beds.
And without nurses, hospitals need extra hands to cover units.
Can't create new nurses overnight. I think this is a long-term challenge. I know certainly there's staffing opportunities, and we'll try to see what we can do to help support that. But there is no easy solution. There's no cavalry coming that's going to bring in a whole army of new nurses to fill in. It's just not there.
President of North Mississippi Medical Center, Dr. David Wilson, says their healthcare system is no stranger to the shrinking numbers.
We have the opportunity to compare notes throughout our state as well as throughout the nation, and everybody is finding this immense shortage of healthcare personnel right now. So bed availability is not really the primary issue. It's our ability to staff those beds.
Their experts agree. One thing can help: getting the shot.
We are where we are today because of the lack of vaccination. So we want the public to consider vaccinations, or really we're urging the public to get vaccinated. If not for themselves, then do it for a family member, do it for a loved one.
Dr. Dobbs says the state is in the midst of the worst surge in numbers. Health leaders encourage the public to contact your local medical center to set up a free vaccination appointment, or go to our website for pop-up locations over the next couple of weeks. That's on WCBI.com.